In King Street area, I know of 8 deaths from the COVID. 4 of them I knew personally, and it was heartbreaking. 2 of them I went to school with. I knew them well, and it just impacts you in a lot of ways. In the shop where I worked, we had been wearing masks, we had been using hand sanitizer, we had been spraying Lysol, bleaching things down because we were concerned. I decided I'd go get tested because I still had a little scratchy throat. When I got tested, it was done through MUSC. They contacted me online and on the phone. They did not waste any time. They were right on the spot.
When a patient comes in with a diagnosis of COVID-19, we monitor them. We have their back so that signs, symptoms of either increasing need for care or stabilization or decreasing need for care, all of these are monitored on a daily basis.
It's hard to tell them what's going to happen in the next 5 to 10 days. You may have cold symptoms, you may have flu symptoms, you may get much worse. In this way, I can say, look, we're going to be monitoring you day to day. And if you get worse, we'll respond to it very quickly.
A lot of systems have adopted a remote patient monitoring model in order to keep the healthcare systems from being overwhelmed. So it has a huge role in taking patients who have tested positive for COVID-19 and aren't exhibiting, they don't manifest the disease in the way that some people do.
All I had to do was pull it up on the computer and answer the questions each day. They were very kind, they were very thoughtful, they reassured me that somebody was there and could help and answer any questions you have, because it's scary. I wasn't sick enough to go to a hospital, and I never had a temperature. And I asked them if, do you have all the symptoms, or can you just have some of the symptoms? And they said, you can have some, you don't necessarily, nobody may not have them all. And they told me what to do in my home to make it safe for my family, because I had nowhere that they could go to leave to be isolated from me, or vice versa. It just gave me confidence and made me feel, like I say, safe. And I was reassured. I wasn't as frightened.
So I've heard primary themes of attenuating or getting rid of, or just taking the fear out of the equation, taking the alienation out of the equation. They feel connected. And along with that, connecting in a real authentic way.
So that way we're keeping contact and a sort of accountability for our patients, in a much more timely way. But I think what it's done is helped some people who really did need to be seen and didn't quite know it, and the nurse was able to say from the phone, and get a video maybe going to say, I really think you need to be seen today, And then some people who were just very anxious about it, again, understandably, they were able to give them some reassurance.
I felt like what I was doing was safe because I'm talking to people that know what's going on. They're seeing this every day. People have a tendency to say this and say that, and they don't have a clue, And these people do. They know what they're doing, they're well trained, they're just wonderful people.